has taken a long time, there's no doubt. I think this was sanctioned or conceptualized in the year 2008. The date of sanction is in 2008, and it has taken a long time to finally have this and to finally inaugurate it formally. But let me tell you that inauguration is one part. The work towards taking care, the treatments, prevention, diagnostics, post-treatment care, all these have been going on without the establishment of this specific cancer wing. And our doctors have been working so hard, and today we see that the results of that in our young friend Marshall and also our friend Harmujai and countless other cancer survivors who have been treated by our doctors here. Thank you so much to all the doctors. I know it's not easy for them. They lead such a stressful life. And it is really, I think, once in a while, our words of gratitude are very important to show our appreciation for all the work and the sacrifice that they are giving and they're doing. So really a very big thank you from my side for all that work that has taken place for cancer care. Cancer is something we all know that we can just imagine someone going and with a small problem and being told by the doctor after proper diagnostics that he has been diagnosed with cancer. It's literally like a death sentence for so many people. It just, it just suddenly the world is very, very different with the kind of the morale that comes down and the kind of sadness that seeps in to any individual who has to unfortunately be told that he's been diagnosed with cancer. That is why I think that this disease, which has been so dreaded, this needs a special focus. This needs not just treatment and care, as Mr. Sampath was mentioning, but we need to move towards the preventive side of cancer. And there is a lot of science which is working towards how we can prevent cancer in the future. And let me assure everyone, the citizens of our state, that we as a government, we are wanting to take the bull by its horn here. And we want to really not just treat cancer, but also move towards how we can prevent this dreaded disease. And I'm happy that yesterday we signed an MOU with the Apollo Group, a program which has been sponsored by the World Economic Forum, and this I feel is going to go a very, very long way in tackling this disease. I'm happy that the FCC, the first cancer care project, is going to be associated and will work in tandem with our cancer wing, and a lot of activities will be taking place. Cancer is, as we all know, the treatment takes a very, very long time. It sometimes stretches over maybe 3 to 4 to 5 years, which is why a dedicated approach is badly required. And that's why the FCC has been brought about. We are looking at how we can screen. Early detection would lead to early diagnosis and early treatment, which would, I think, have a huge impact in the way that we treat our cancer patients, in increasing the rate of survival of cancer patients. So these sort of things are so exciting for us as a state, and I'm very, very proud of the fact that we are one of the first few states to have come up with the FCC. And thank you to the World Economic Forum, and we look forward to this partnership with the Apollo Group, which is a well-established, very reputed and respected organization. And we are very hopeful that this partnership is going to go a very, very long way in making sure that we take care of our cancer patients. I'm also very happy to announce here that, as was being mentioned by Mr. Kumar about the population-based cancer registry that we are going to establish for East Khasi Hills. Uh, this is something that it's not just for East Khasi Hills but for other districts as well. For Garo Hills also, we will be establishing this PDCR, and very soon I'm also very hopeful because we are moving towards establishing a similar cancer wing in Garo Hills also in Tura. So with these kind of initiatives and interventions, we feel that we will be able to take care of cancer in a very focused manner, and we really look forward to all these actions. Um, will help our state, which is, as we all know, we have the highest number of cancer cases in the country, perhaps. So this is very alarming, and we hope that by these interventions we will be able to substantially bring down the number of cases of cancer in our state. So I would like to say this, that this is just the beginning. We have the cancer wing. Lot of things will take place through the cancer wing. Focused approach is going to be put in place. But as I said, this is just the beginning. There is a lot of things that we still need to do. A lot of things in terms of diagnosis, in terms of treatment, in terms of post-treatment care, palliative care. All these things will be done through our cancer wing, but there is, as I said, a lot more that needs to be done. So it's an ongoing process, and we will not be stopping here. We will keep upgrading this. We will also keep upskilling our HR, so that the kind of fight against cancer will be very collective. We will be also encouraging a lot of community participation in terms of our fight against cancer, as was mentioned by our Principal Secretary, that the village health councils, this is a remarkable thing that we have started as a state. And this village council, health council, sorry, is going to play an integral role in reaching out to the rural masses, where a lot of cancer cases are coming up, which usually go undetected, and when it's too late, they come and then they seek care, but it's too late by that time. So village health councils, which is a marvelous idea, is going to be playing a very important role in looking at how we take care of things, especially since we're talking about cancer and the establishment of our cancer wing towards cancer. So dear friends, I just want to say this, that I'm very thankful to our Honorable Chief Minister for all the support that he has given the health department. Without the kind of support that was shown by our Honorable Chief Minister, all this would not have been possible. So last but not the least, I would like to also thank him for his constant support to the health department. We are, I think, in terms of our budgetary spending, the fourth largest budget, in terms of that. We are the fourth state in the country, the fourth highest state in the country in terms of our budgetary spending on health. And this was not possible if our Honorable Chief Minister did not have that support towards the health department and concern towards the health sector, that he has been constantly, always been very supportive. So very big thank you to our Honorable Chief Minister as well. So without further ado, I'd like to thank everyone who has been part and parcel of making this dream a reality. I know it has taken a long time, but I think that finally we have our cancer wing, and we will be seeing a lot of difference, a lot of positive change taking place in terms of cancer, its treatment, and its prevention. God bless all our doctors, God bless all our officers, our nurses, the other non-medical staff that we have, the diagnostic staff that we have. God bless each and every one of you. Kublai Shivun Patela. Jai Hind.